So many Americans put off surgery because they worry about the recovery process. If we told you recovery could be easier than the pain you're currently experiencing, there would be no reason to wait. That's where Dr. Kevin Kruse with Texas Orthopedic Associates comes in. He's here this morning with his patient, Cary, who had surgery 2 years ago and can now do things he had been missing out on. And they join us to share why you should not wait to have your shoulder fixed. Good morning to both of you.
Good morning.
It's great to be able to move around, isn't it?
It's awesome.
Okay, Cary, talk about what your life was like before surgery and what made you decide to have Dr. Kruse specifically perform your shoulder replacement.
Well, really, I had been cut to 50% of what I normally do. I couldn't rope, I couldn't pick up a feed bag. I literally had to lift up my wrist to shake a hand. And I actually happened onto Dr. Kruse by accident because I had pins in my shoulder. And a doctor sent me to him because he could do the sonogram, is that right?
Yep.
Yeah, instead of the MRI. And it was the best choice I ever made.
So we were talking about recovery, and a lot of people put it off because they think, oh, I can't undergo that recovery process. What was it like? Was it easier or harder than you expected it would be?
Well, I'd had multiple scopes, and I thought, oh, this is going to be horrible. But in reality, it was half of what the scope was. I mean, it took less than a month to really have me back and moving, and I had no pain whatsoever.
And do you wish you'd found Dr. Kruse before you did?
Oh yeah, about 20 years ago.
Okay, so Dr. Kruse, the question is, patients, they're able to recover quickly after your surgery. Why is that, and what do you do different from other doctors?
A couple things. I think, three main things really. I think the technology we use, it's a computer technology that's everything's customized to the patient, right? So that allows us to then do the surgery much more efficiently. And so our surgical times are typically less than 30 minutes for a replacement. So you have less anesthesia, and we do it through a smaller incision. Mm-hmm. So those two things then set you up to be able to rehabilitate quicker. If people have less pain after the surgery, they can do more, and everything kind of stacks on top of each other. So I think it's a combination of many different things that we do that all add up into a much better result for our patients.
You do a lot of it, so you have it really down to a science,
yeah,
so to speak. Sure. What are the main reasons people put off shoulder surgery?
Number one thing is the fear of the recovery. The fear of going through a ton of pain when you're already in pain and having to kind of walk through this fire to get to the other side. And the vast majority of our patients say what Cary said, and that's, I wish I would have done it sooner because it's not nearly as bad as I'd pictured in my mind.
Okay, so
the recovery process.
Cary, we got a few seconds left. What would you say to viewers who are watching right now who may be in pain? What would you tell them about when to do it and about going to Dr. Kruse?
As soon as you possibly can. Last year I did almost 33,000 push-ups, and so it's an amazing difference.
Good for you. I'm so happy for you. And thanks for joining us this morning. We really appreciate it. Dr. Kruse, thank you very much. Texas Orthopedic Associates says you deserve the best care available for your shoulder. Call 214-390-3815 or go to kevinkrusemd.com to book your appointment today.